right, in this explainer, we're going to break down a rare congenital condition called Sturge-Weber syndrome. We'll look at where it comes from, its most noticeable features, and, how it's managed, all based on our source material. So let's jump right in.
So take a look at this picture. This is probably the most visible sign of Sturge-Weber syndrome. This birthmark is often the very first clue. But the real story, what's really going on, is happening underneath the surface. And that's what we're here to uncover. To really get a handle on the full scope of Sturge-Weber, let's start with a clear definition, right from the source. At its core, Sturge-Weber syndrome is a vascular disorder. That just means it affects the blood vessels. And its more technical name, encephalo-trigeminal angiomatosis, actually gives you a few hints about the areas it impacts. Encephalo for the brain, and trigeminal for a major nerve in the face.
Now, this is a really key point. This isn't something that develops later in life. It's congenital, which means it starts during development in the womb and is present right from birth. That's absolutely fundamental to understanding the syndrome.
Okay, so let's focus on the most recognizable feature of Sturge-Weber syndrome, the one that usually gets the ball rolling on a diagnosis. This right here is what's known as a port wine stain, and you can probably see why it gets that name, from its deep, reddish-purple color. But it's so much more than just a birthmark. Its specific characteristics are actually crucial clues.
So here are the key things to know about it. It's there from birth, it's typically unilateral, meaning just on one side of the face, and it follows the path of the trigeminal nerve. This very specific pattern is a huge signpost for doctors.
But that port wine stain is really just the tip of the iceberg. The vascular issues that cause it run much deeper, affecting the brain and even the inside of the mouth. And this is where the condition's complexity really shows. A similar kind of vascular issue can pop up on the surface of the brain, on the very same side as the facial stain. That's what ipsilateral means. This can lead to some serious neurological problems, like epilepsy and even hemiplegia, which is paralysis on the opposite, or contralateral, side of the body.
The effects don't stop there either. You can actually see signs inside the mouth. These images show a lesser-known aspect of the syndrome, where the tissues on the roof of the mouth and the gums are also affected, again on the same side as the facial stain.
So because of those underlying blood vessel issues, the gums and other soft tissues in the mouth can get swollen and even take on a kind of bluish color. It's a pretty clear sign of just how widespread the effects of this condition can be.
Okay, so with all these different signs on the face, in the brain, in the mouth, how do healthcare professionals actually piece it all together to make a definitive diagnosis? Let's take a quick look. Well, the starting point, almost always, is the clinical appearance. Specifically, that classic port wine stain on the face. Its presence, its location, and its pattern. That's the first and most important piece of the puzzle.
But to see what's going on beneath the surface, doctors turn to imaging. Things like MRI and CT scans are absolutely essential for seeing the vascular malformations, or angiomas, inside the skull. These scans can also pick up on tiny calcium deposits in the brain, another telltale sign of the syndrome. So finally, what happens after a diagnosis? Let's touch on management. Living with Sturge-Weber syndrome really means dealing with both the visible parts of the condition and the internal ones.
To manage the visible facial lesion, some people choose cosmetic solutions, like using specialized makeup to cover the port wine stain. Of course, that's a personal choice, but it can really help with the social and psychological side of things. Now listen to this, because this next point is absolutely critical, and it highlights a very serious risk. Because of those vascular issues inside the mouth, something that seems routine, like getting a tooth pulled, can actually be pretty dangerous. Our source material makes it crystal clear. Procedures like that have to be done in a hospital to manage the risk of severe, prolonged bleeding. That is a vital piece of information for patient safety.
And that wraps up our look at Sturge-Weber syndrome. As we've seen, it's not just a birthmark. It's a really complex condition that ties together the skin, the brain, and even oral health in some pretty unexpected ways. Which brings us to a final thought. How does understanding the deep science behind a condition change not just how we see it, but how we care for the people who live with it every day?